Right. Hi, my name is Heather Burke, and this is my patient, Mr. Christopher Burke, and we're going to go ahead and take care of his health history and answer some questions about his assessment. Okay? So I'm going to answer you these questions, Mr. Burke. If you'll give me some answers, would be great. So, can you please tell me about any current medical issues or problems that you have?
Currently, the only medical issue I really have is I think I have problems with the arc in my left foot.
Okay.
Some arthritis in my left knee.
And arthritis. All right. Can you please tell me about any past medical problems that you've had?
Past medical problems is the only issue has been a torn ACL.
And how long ago was that?
Torn meniscus. 2 years. In 1 month.
All right. Can you please tell me about any family history that I should know about, such as cancer, heart disease, lung disease, diabetes, both sides of the family?
Both my parents have hypertension. My dad has glaucoma. My grandfather on my mother's side died of leukemia. And my grandfather on my dad's side died of heart disease.
Okay. And do you currently get eye tests to check for glaucoma, since that's on your dad's side?
No.
All right. That would be some education then. Do you currently take any medications regularly?
I take some supplements, green tea pills, glucosamine, chondroitin, multivitamin.
Okay. And you take those every day?
Most days.
Okay.
Except when I forget.
All right. Can you please tell me about any past surgical history?
I had a surgery April of 2018 to repair a torn meniscus and torn ACL. And that's my only surgery.
Okay. Do you regularly maintain a healthy diet?
Mostly.
Okay. What does your typical day worth of nutrition look like?
Protein shake or some kind of carb in the morning, or just coffee. Usually for lunch sometimes I get a salad and some tuna salad.
Okay.
Sometimes I get a burger, which is not healthy, but
Protein.
protein. Yep, I get plenty of protein.
Okay. What about for dinner?
Dinner is depending on the night, but usually I'm protein, veggies, and a starch. Sometimes too much starch.
Would you say you get enough water a day?
Most days.
Typically, how many ounces a day do you drink?
Probably 60.
60 ounces. All right. What time do you typically go to bed, and roughly how many hours per night do you average of sleep?
10:30ish, and between 5 and 6 hours.
Do you sleep soundly?
Most nights.
Most nights. And do you wake up feeling rested?
No.
All right.
When I get to sleep until I wake up and not have to wake up to an alarm.
Yeah. With alarm. Okay. Got that. How often do you exercise?
Currently with this COVID crisis, nowhere near as much as I want to, but before that I was 3 to 4 days a week for an hour or better.
And what type of exercises do you enjoy?
Weight training.
Weight training?
And I make myself do cardio, but I don't like it.
How much cardio do you typically do?
Probably 90 minutes a week. Spread out. Usually 20 to 30 minutes each time I go to the gym.
Okay. Do you feel like you live in a healthy environment with respect to clean air, water, and pollution? And do you currently have any concerns about your environment?
No. I feel like I live in a pretty healthy environment, air-wise. House is pretty clean. We don't live in a city, so the air pollution's minimal here.
Okay.
But there is plenty of pollen if we want to add that.
Allergy season.
Yeah.
Got it. Okay. How do you obtain your needs daily or weekly in regards to groceries and medications and gas?
It's not on the schedule. It's just random.
Okay.
When I need it, I
Do
go.
you have any issues getting there?
No.
Okay. Do you receive any sort of financial assistance or support services?
No.
Okay. And I'm assuming most of your daily medications, like you said, all of your supplements and everything, you can get over the counter at most medication at pharmacies or Walmart. Okay.
Yeah. In the diet and nutrition section.
All right. What is your highest level of education?
Associate's degree.
In?
Nursing.
What do you do for a living for your income?
I am a nurse. Currently working in
Specifically?
dialysis.
Do you have to travel far for work?
Some days.
Okay. Who lives close by to you in regards to your family?
My parents live about 15 miles away. I think my brother's only about 15 or 20 miles away too. Both of them. Grandmother's 3 miles away. So, pretty centralized.
Okay. Who lives at home with you?
I live at home with my wife and I have custody of my son 50% of the time. 13-year-old, almost 13. Acts
Alright.
like he's 15. But
Would you like any of them to be involved in your care, and how far into your care?
I'd like my wife to be involved.
In all care, if we were to discuss a care plan or any type of future assistance that you might need?
Yeah.
Do you currently have any customs or beliefs around life events such as birth, illness, or death that I should know about? And if yes, what are they so I can accommodate your wishes during your care plan?
No specific beliefs around life and such events.
Do you have faith in a god, spirit guides, angels, or any type of higher power?
I believe in God.
And how do those beliefs play a part in your health?
I don't really know. Just how I guess how I live my day, knowing or I don't stress out too much about day-to-day events. No, I don't worry about like food, clothing, and all that. I know I'm being provided for.
So you don't worry about like those necessities that you need to live off of?
Yeah.
Okay.
Try not to stress about things that are not in my control.
Okay. Do you feel safe at home?
Except when my wife swings the frying pan at me. Yes, I feel safe at home.
Are there any concerns for your well-being or the well-being of those who live with you, such as your wife or your son?
No concerns. You have to re-record this.
Great. Alright, so I'm going to go through a list of symptoms, and I'm going to go kind of by body system, and I just want you to tell me yes or no whether you have or currently having any of these particular issues. So in general, any type of weight loss or gain that's unusual for your normal.
No.
Okay. Any type of fatigue.
That's unusual for my normal.
That's unusual for normal.
No.
Okay. Any consistent fever or chills?
No.
Any weakness?
No.
Trouble sleeping?
Occasionally.
Occasionally? All right.
Especially with the stressful situation we're in right now.
All right, let's talk about your skin. Do you have any rashes?
No.
Okay. Any lumps?
No.
Any itching?
Yeah.
Specific?
Right here, I got eczema on my face.
Dryness?
Yes.
Same place?
Yep.
Any color changes?
No.
Okay. Any hair or nail changes?
No.
Less growth, longer growth? Okay. Moving to your head, consistent headaches?
No.
Any head injuries I should know about?
Maybe later. No. None currently.
Except when your wife swings a frying pan.
Or my mother-in-law, one or the other.
Let's talk about your ears. Any issues with hearing? Any decreased hearing?
Mm-mm.
Ringing in the ears?
Yeah, once a month or so I get a little ring in my ears. Depends on something.
Any earaches?
No.
Any type of drainage?
No.
Okay. Let's move to your eyes. How would you say your vision is?
Not perfect, but pretty good.
Fair.
Yeah, used to be better.
Do you wear glasses or contacts?
No.
Do you have any pain around your eyes?
Depend. Allergy season, I do.
Allergies. Any redness?
No.
Okay. Blurry or double vision?
No.
Flashing lights? Do you see flashing lights
No.
or any of like the little specks anywhere?
Mm-mm.
Okay. You've not been diagnosed with any type of glaucoma currently.
Not currently.
Okay. Cataracts?
Nope.
When was your last eye exam?
15 years ago.
That will be in the care plan. All right, let's talk about your nose. Any type of stuffiness?
Not currently.
Okay. Discharge? Any extra discharge from your nose?
Mm-mm.
Any itching internally?
Mm-mm.
Nosebleeds?
No.
Sinus pain?
No.
Okay.
Had a random sneeze here and there.
Sneezing just a little bit.
Violent sneezes.
All right, let's move to your throat. Teeth? Pain? Gum pain? Any bleeding?
No.
Dentures?
No.
Sore tongue?
No.
Dry mouth?
No.
Sore throat?
No.
Hoarseness?
No.
Thrush?
Nope.
Non-healing sores?
Nope.
When was your last dental exam?
8 months ago. Due for one.
Any lumps in your neck?
Nope.
Swollen glands that you've
Mm-mm.
been made aware of? Any pain in your neck?
No.
Any stiffness?
No. Do I need to do a breast exam?
No. Respiratory, let's talk about, have you had a dry or a wet productive cough?
No.
Any sputum?
Nope.
Okay. You're not coughing up any type of blood, having any shortness of breath, wheezing, or any painful breathing?
Not without significant exertion. Shortness of breath comes walking upstairs or not in my cardio is not up to par.
Okay.
But no unexpected short of breath, I guess.
Okay. Any chest pain or discomfort? Any tightness?
Nope.
Palpitations?
Nope.
You said shortness of breath with activity, but significant activity.
Mm-hmm.
Any difficulty breathing lying down?
No.
Any swelling?
No.
Do you suddenly awake from sleep with any shortness of breath?
No. I do have swelling in my leg.
Which leg?
Or on my left leg from my knee. If I'm on my feet too long, it's begun.
Okay.
It's a little edematous.
Any swallowing difficulties?
No.
Any
Definitely
heartburn?
Occasionally.
Okay. Any change in appetite?
Yeah.
How so?
I tend to eat less when I'm stressed out. I haven't ate as much as I normally do lately.
Any nausea?
No.
Any change in bowel habits?
No.
No rectal bleeding?
Nope.
No constipation?
No.
No diarrhea?
No.
Yellow eyes or skin?
Nope.
Okay, by looking
I'm
at you.
not jaundiced.
Do you have any frequency with urinary
Nope.
issues? Any urgency?
Nope.
Burning or pain?
Nope.
Any blood in your urine?
Nope.
Any incontinence?
No.
Any change in your flow?
No.
Do you have any pain with sex?
No.
A hernia that you're aware of?
No.
Any discharge from your penis?
No.
Any sores?
No.
Masses or pain?
No.
Any STDs that you're aware of?
No.
Any erectile dysfunction?
No.
Do you have any calf pain when you're walking?
No.
Any type of leg cramping?
Occasionally, I have my foot will cramp.
Foot? Any specific foot or both?
Both feet.
Both. Okay. All right. Musculoskeletal. Do you have any muscle or joint pain?
Left knee.
Left knee.
Occasionally, if I'm on it too long.
Stiffness.
If I sit too long.
Okay.
Yes, on the same knee.
Back pain.
If I'm lying down too long.
Okay.
I'm old. I get it.
Redness of joints
No.
or swelling.
Mm-mm.
Okay.
Joint doesn't swell, it's below the joint.
Almost done. Do we have any dizziness?
Mm-mm.
Any fainting?
No.
Any seizures?
No.
Any numbness or tingling?
Nope.
And no tremors?
Nope.
Okay. Ease of bruising or ease of bleeding if you hit your hand or anything?
No.
Do you have heat or cold intolerance?
No.
Okay. Any sweating, excessive sweating?
Only when it's hot and I'm working out. So.
Okay. Working out, which is normal.
Mm.
Any frequent urination?
No. When that under the other section.
Any thirst?
No.
Okay.
Well.
We're not drinking enough water. Do you have any nervousness or like high anxiety?
No.
Okay.
Not usually.
Any signs of depression?
No.
Any memory loss that you're
Mm-mm.
aware of? And then stress was yes,
Yes.
because you've talked about that a few times. Okay. Thank you, Mr. Burke.
I have had some issues with, like, if I'm in a large crowd, with being anxious in large crowds. But
Anxious in large crowds.
like, that's why I don't do New York City.
Great. Thank you.